Hey guys, Jim here. Welcome back to our Vascular Sonography Registry review. Let's keep rocking this test. Question 51. When this condition is symptomatic, which of the following is the more common reason? A, result of an old femoral bone fracture reducing the space in popliteal fossa. B, abnormal development of the medial head of the gastrocnemius muscle. C, chronic inflammation of the popliteal nerve and artery. Or D, acute popliteal artery occlusion. The answer is B, abnormal development of the medial head of the gastrocnemius muscle. And this is called popliteal entrapment syndrome. Question 52. Which of the following is within the claudication range? A, 0.89, B, 0.6, C, 0.4, or D, 0.2? The answer is B, 0.6. So the range of claudication goes from 0.5 to 0.8. Question 53. When a patient with celiac artery compression syndrome breathes in, what happens to the common hepatic artery blood flow in relation to the celiac trunk? And what happens to the splenic artery blood flow when the patient breathes out in relation to the celiac trunk? A, the common hepatic artery blood flow increases while the splenic artery blood flow increases. B, the common hepatic artery blood flow decreases while the splenic artery blood flow increases. C, the common hepatic artery blood flow increases while the splenic artery blood flow decreases. Or is it D, the common hepatic artery blood flow decreases while the splenic artery blood flow decreases? Celiac artery compression syndrome occurs when the median arcuate ligament compresses the celiac artery during expiration. When the patient breathes in, that median arcuate ligament will decompress the celiac artery, allowing blood flow to flow through more easily. To answer the first part of this question, when the patient breathes in, that ligament will decompress the celiac artery, allowing blood flow to increase in the common hepatic artery. And already we can rule out two options, B and D, because we know that the blood flow increases. So the answer is either going to be A or C. Now the second half of this question is blood flow will decrease distal to the stenosis during expiration. So now we can rule out the last option, and that leaves us with the correct answer. So the common hepatic blood flow will increase during inspiration, and the splenic artery will decrease in blood flow during expiration. So the choice is C. Question 54. Which of the following is the best way to improve this Doppler image? A, increase pulse repetition frequency. B, decrease wall filter. C, increase persistence. Or D, increase color gain. You can see here that the scale is set at 28, indicating that the color scale is optimized for this procedure. You're not going to increase the color gain because that will put artifacts in the surrounding tissue, and you're not going to decrease wall filter because there's no low-level frequencies to get rid of. And since pulse repetition frequency is directly related to the scale, which doesn't need to increase, that leaves us with persistence. So increase the persistence, and that will create a smoothing to fill in the Doppler flow. Question 55. As a result of this ultrasound finding, what will happen to the venous flow proximal to the abnormality? A, becomes more phasic. B, becomes more pulsatile. C, becomes a higher resistant flow. Or D, velocity will decrease. This is called an AVM, or an arteriovenous malformation, and venous flow proximal to this abnormality will be more pulsatile. Question 56. Which of the following is considered pathologic retrograde reflux flow upon release of distal compression for the superficial venous system? A, greater than 1,000 milliseconds. B, greater than 0.5 milliseconds. C, greater than 5.0 seconds. Or D, greater than 500 milliseconds. Be prepared for your boards to be able to convert from one unit to the other. You probably read in your textbook that anything greater than 0.5 seconds is considered a pathologic retrograde reflux. However, we don't have that option here. When you convert seconds to milliseconds, you're just going to move the decimal point over 3 times. So 0.5, let's say the decimal point's here, you go 1, 2, 3, and you have 500 milliseconds. This is the correct answer. Make sure you pay close attention to the units, because 0.5 milliseconds is far different than 0.5 seconds. Question 57. Click on the structure that connects the IVC to the kidney. The answer is right here. That vessel is called the left renal vein. Question 58. When you're scanning in the popliteal area, which of the following will increase venous flow? A, Valsalva. B, compression above the knee. C, release of mid-calf. Or D, release of mid-thigh. This is a really tricky question. The correct answer is release of mid-thigh. A lot of people will choose compression above the knee, but this is incorrect for this question, because if you compress the mid-thigh and you're looking at the popliteal vein, this will decrease blood flow in the popliteal vein. Obviously, Valsalva is not going to increase blood flow. The release of mid-calf, that's not going to work. Now, if this said compression below the knee, let's say the calf, that would be the correct answer. But when you release the mid-thigh or decompress the femoral vein, that will allow blood flow to flow more easily throughout the popliteal vein and up to the heart. Question 59. If the ankle brachial pressure is normal and the flow is normal, what can you expect to see post-exercise? A, 1.0, B, 0.75, C, 0.7, or D, 1.05? It's normal to see your ABI to increase post-exercise. 1.05 would be the correct answer. Question 60. Which of the following is the ability to accommodate a large change in volume in a short amount of time? A, capacitance. B, compliance. C, compensation. or D, patency? The answer is A, capacitance. Question 61. A patient returns after endarterectomy surgery because the patch is failing. What can you expect to see? A, pseudoaneurysm, B, AVM, C, endovascular leak, or D, restenosis? The answer is D, restenosis. Question 62. Which procedure was performed on this patient? A, EVAR, B, stent placement, C, endarterectomy, or D, graft placement? The answer is C, endarterectomy. Question 63. Click on the structure that connects the aorta to the left kidney. The answer is right here, the left renal artery. Question 64. According to this ultrasound of the left subclavian artery, which is the true vessel? A, the vessel furthest away from the transducer, B, the vessel closest to the transducer, C, both vessels are the true vessels, or D, both are artifacts. The answer is B, the vessel closest to the transducer is the true vessel. This is called a colored Doppler mirror image. This occurs more often when examining the left and right subclavian artery because this vessel is so close to the apex of the lung. What happens is the transmitter pulse will come down and reflect off the apical oblique surface of the lung. It will travel to the left or right subclavian artery and then back to the transducer. This will trick the ultrasound system into thinking that that transmitted pulse traveled longer. So it will displace that artifact deeper in the tissue. Question 65. Which of the following best describes this Doppler spectral imaging? A, monophasic torus parvis, B, spectral window, C, spectral broadening, or D, high resistance? The answer is C, spectral broadening. Spectral broadening occurs when echoes fill in your spectral envelope. In a normal vessel, this should all be anechoic or free from any echogenicity. Reasons for this include a stenosis or if your sample gate is too wide. Question 66. You are examining a patient's celiac axis and notice retrograde flow in the common hepatic artery. Which of the following is going on? A, severe or occlusion in the left splenic artery, B, severe or occlusion of the common hepatic artery, C, severe or occlusion of the celiac artery, or D, severe or occlusion of the gastroduodenal artery. The answer is C, severe or occlusion of the celiac artery. Don't confuse this with celiac artery compression syndrome. In the question, it's not saying that the patient breathed in or out. It's just stating that the patient's celiac axis is being examined. And this is what you notice. So obviously there's chronic disease if you have retrograde flow in your common hepatic artery. Question 67. Which of the following is considered a normal value for this type of procedure? A, less than 200 liters per minute. B, greater than 300 liters per minute. C, less than 600 milliliters per minute. Or D, greater than 800 milliliters per minute. This is called a hemodialysis graft, and values greater than 800 milliliters per minute is normal. Question 68. This patient who has chronic venous insufficiency demonstrates what kind of physical sign? A, phlegmasia albidolens, B, pallor, C, brawny, or D, phlegmasia cerealia dolens. The answer is C, brawny. Question 69. Which of the following structures are directly affected as a result of thoracic outlet syndrome? A, subclavian artery and vein, brachial plexus nerve, and an extra first rib. B, axillary artery, brachiocephalic artery, and the circumflex nerve and the scapula. C, common carotid artery, innominate vein, and an old collarbone fracture. Or D, subclavian artery, axillary vein, brachial plexus nerve, and the scalene muscles. The answer is A, subclavian artery and vein, brachial plexus nerve, and an extra first rib. Question 70. Click on the structure that connects the aorta to the kidney. The answer is right here. This is the right renal artery in the coronal view. Question 71. Which of the following describes many blood cells moving slowly? A, low velocity, high flow. B, high velocity, low flow. C, high velocity, high flow. Or D, low velocity, low flow. The answer is A, low velocity, high flow. Question 72. Which of the following best describes these spectral waveforms? A, low resistance, low velocity. B, biphasic. C, monophasic. Or D, high resistance, high velocity. This is considered monophasic, choice C, and this can indicate an obstruction downstream. Question 73. This patient is at most risk for what? A, cardiac failure. B, tissue ischemia. C, blue toe syndrome. Or D, deep vein thrombosis. The answer is B, tissue ischemia. Question 74. Click in the area where the dicrotic notch is located. The answer is right here in this region. Don't be fooled into thinking that the notch is here or here. It's going to be right here. Question 75. Which of the following is the best way to optimize this Doppler image? A, increase TGCs. B, increase color gain. C, increase pulse repetition frequency. or D, increase axial resolution? The answer is C, increase pulse repetition frequency. Well, that concludes our next 25 questions of this vascular sonography registry review. I'll hurry and write 25 more questions and upload that video as soon as I can. I'm Jim with ultrasoundboardreview.com. Thank you so much for watching.